Bismillahirrahmanirrahim. Assalamu alaikum dear students. Welcome to your channel The Anatomy Canvas. In today's class we are going to discuss with the neuroanatomy MCQs with their explanation, that is your part 2. So the first MCQ in today's class is that the floor of the fourth ventricle is formed by, so that is the superior medullary velum, inferior medullary velum, the cerebellum, the back of medulla, and none of above. So it's very clear that floor of the fourth ventricle is formed by the back of the medulla, and D is your correct option. Next MCQ is that 58 years old woman was diagnosed as having advanced carcinoma of the neoplastic infiltration of the posterior cranial fossa, especially the anterolateral part of the medulla oblongata. So which of the following cranial nerves are most likely to be affected? So please remember, this is anterolateral part of the medulla oblongata in the posterior cranial fossa. So nerves which are affected may be facial vestibulocochlear, may be hypoglossal nerve, may be olfactory and accessory nerve, the trigeminal or abducent nerve, or trochlear or and oculomotor nerve. So look at this diagram. This is the anterior most, this is the anterolateral part of the medulla oblongata, and nerve which is emerging through the anterolateral part is the hypoglossal nerve. So correct option is the option B, that is the hypoglossal nerve, which is affected by the neoplastic infiltration of the posterior cranial fossa in anterolateral part of medulla oblongata. Next question is the epithelium is formed by all of the following except, so maybe epithelium is formed by, look at this diagram. This is the pineal gland, then the pineal recess, the posterior commissure, the habenular commissure, and the stria medullaris. So these four are the parts of the epithelium. The anterior commissure is present anteriorly and it is not forming the part of the epithelium. So correct option is anterior commissure, that is C, which is not part of the epithelium. The midbrain contains all of the following except crus cerebri, the substantia nigra, the third ventricle, the oculomotor nuclei, trochlear nerve nucleus. So very clear that third ventricle is present in the cerebral cortex and it is not part of the midbrain. So correct option is option C. Next question is that the 12-year-old girl was diagnosed as suffering from the medulloblastoma of the cerebellum. Clinical and radiological examination revealed that the tumor was predominantly invading the right cerebellar hemisphere. So knowing that cerebellum is concerned with coordination of motor activity, so that complex voluntary movements involving antagonistic muscle groups can take place in a precise manner. Which side of the body is most likely to be affected? So this is a long scenario, but very easy to understand that the right cerebellar hemisphere is affected, and as we all know that these right cerebellar pathways are ipsilateral, so the right side of the body will be affected. So right, both the spinocerebellar pathway, the anterior one and the posterior one, both are ipsilateral, so there will be lesion on right side of the body, and option D is the correct option. Next MCQ is that MRI of the brain, the coronal horizontal section of a 55-year-old man show enlargement of left lateral ventricle and an area of the low signal intensity close to the left interventricular foramen, suggesting the presence of the brain tumor. Using your knowledge of neuroanatomy, what are the different parts of the left ventricle? So look at this diagram. This is the left ventricle, its frontal part, its occipital part, and its temporal part, and this is the body. So the correct option is the frontal, temporal, occipital, and body. These are the different parts of the left ventricle. There is no parietal part. Next MCQ is a medical student while performing an autopsy found clot near the corpus callosum. Using your knowledge of neuroanatomy, what are different parts of the corpus callosum from anterior to posterior side? So look at this diagram. This is the anterior part and this is the posterior part. So first it is the rostrum, then it is genu, then body, the isthmus and the spleen. So option D is the correct option, that these are the parts of the corpus callosum from anterior to posterior side. Next MCQ is, a physician turned to a group of the students and said, I think this patient has an advanced neoplasm in posterior cranial fossa. Again, there is the neoplasm in the posterior cranial fossa. So with involvement of medulla oblongata and in particularly nucleus of the vagus nerve. So it is not possible to have a solitary lesion of the vagal nuclei without involvement of the other cranial nerves. So if yes, which cranial nerves are most likely to be involved along with the vagus nerve? So first look at this diagram. This is the anterior view of the medulla oblongata, and this is the anterolateral sulcus, and this one is the posterolateral sulcus, and we know from anterolateral sulcus the hypoglossal nerve emerges, and from the posterolateral sulcus this is 9th, 10th and 11th nerves are emerging. So with the lesion of the 10th nerve, the 9, 12 and 11 all will be affected. So the correct option is the C, that is the glossopharyngeal, the accessory and hypoglossal, that is 9, 11 and 12 will be affected along with the vagus nerve. Next MCQ is, 32-year-old woman with syringomyelia was found on physical examination to have impairment of appreciation of the pain and temperature of face but preservation of the light touch. Using your knowledge of neuroanatomy, explain this dissociated sensory loss in the face. So look at the options. First, the ganglion of the trigeminal nerve. If this ganglion is affected, there will also be loss of the light touch, and similar is to the lemniscus of the trigeminal nerve. Then if main pontine nucleus of the trigeminal nerve is affected, there will be loss of the proprioception. The mesencephalic nucleus of trigeminal nerve carrying sensation of light touch, and this light touch is preserved. And spinal nucleus of the trigeminal nerve carries the sensation of the pain and temperature. So correct option is the spinal nucleus of the trigeminal nerve is affected, and this is the reason for the dissociated sensory loss in the face. In an automobile accident, which structure present within the skull limit the damage to the cerebral hemisphere and other parts of the brain? So cerebrospinal fluid, CSF filled ventricles, the meningeal layers, the meninges partition, both the meninges and the CSF, they are protecting the cerebral hemispheres and other parts of the brain. So correct option is E. Next MCQ is that the lateral medullary syndrome is usually due to occlusion of the anterior spinal artery, the posterior spinal artery, the anterior inferior cerebellar, posterior inferior cerebellar, or the posterior cerebral artery. So posterior inferior cerebellar artery is basically responsible for the lateral medullary syndrome, and infarction in this artery leads to the lateral medullary syndrome, and this is the correct option. Next MCQ is, during automobile accident, head injuries are most common. Which of the cranial nerves are most likely to be damaged during the automobile accident? So olfactory, optic or facial. The optic, oculomotor or abducent, oculomotor, abducent and trochlear. Trochlear, facial and abducent, vagus, accessory and facial. So correct option is C, because oculomotor, abducent and trochlear, these are the nerves which are having the long course and they are crossing the bridges from the posterior and medial cranial fossa to the anterior cranial fossa to supply the different parts of the eye. So these are the effects which are nerves which are commonly affected in case of the head injury, and option C is the correct option. Next MCQ is, medial medullary syndrome is due to occlusion of anterior cerebral artery, medial cerebral, posterior cerebral, anterior spinal or the posterior spinal. So correct answer is the anterior spinal artery. The infarction in the anterior spinal artery leads to the anterior medial medullary syndrome. Next MCQ is that part of the limbic system includes all of the following except, that is the hippocampus, the amygdaloid nucleus, mammillary body, caudate nucleus and cerebellum. So very obvious, cerebellum is not the part of the limbic system. Next MCQ is that association fibers include all of the following except. So corpus callosum, superior longitudinal fasciculus, inferior longitudinal fasciculus, the cingulum and the fasciculus uncinnatus. So we all know that corpus callosum contains the commissural fibers. These are not the association fiber, and this is the correct option. Next MCQ is that a 50-year-old man was being investigated for signs and symptoms that suggested the presence of the cerebral tumor. Examination of the CT scan show gross enlargement and distortion of the left lateral ventricle. So using your knowledge of neuroanatomy, determine the location of the tumor in this patient. And this is basically left lateral ventricle which is affected, and aqueduct of Sylvius, the central canal of the spinal cord, foramen of Monro, left interventricular foramen and right interventricular foramen. So the left interventricular foramen is basically the one which is affected, which is blocked, which leads to enlargement and distortion of the left lateral ventricle. Next MCQ is inferior cerebellar peduncle contains all of the following except, that is the dorsal spinocerebellar pathway, the ventral spinocerebellar pathway, the vestibulocerebellar, olivocerebellar or the cunocerebellar. So we all know that the ventral spinocerebellar pathway enters the cerebellum through the superior cerebellar peduncle and not through the inferior, and this is the correct option. Regarding the anterior limb of the internal capsule, all of the following statements are correct except that lies between the head of the caudate nucleus and the lentiform, contains the anterior thalamic radiations. Yes. Contains fibers from anterior thalamic nucleus to the cingulate gyrus. Yes. Contains non-frontopontine fibers. So there are no non-frontopontine fibers in the internal capsule, supplied by the branches of anterior cerebral and middle cerebral. Yes, it is also true, because the anterior cerebral also supplying the anterior limb of the internal capsule, and middle cerebrals also giving branches to the anterior limb of the middle capsule. The tract mediating the conscious-unconscious proprioception from the upper limb to the cerebellum is. So this is unconscious proprioception, important point. And next important is from upper limb to the cerebellum, that is gracile, the dorsal spinocerebellar, ventral spinocerebellar, cunocerebellar and lateral. So correct option is the cunocerebellar pathway, because this is the pathway which is carrying the unconscious proprioception from the upper limb to the cerebellum. Next MCQ is that the following tracts mediate the pain and temperature sensation from the body: the gracile tract, the ventral spinothalamic tract, lateral spinothalamic tract, ventral spinocerebellar and dorsal spinocerebellar. So we all know the gracile is the basically related with the dorsal column, which are taking the sensations of the vibration and proprioception. Then the ventral spinothalamic tract is taking the sensation of the fine touch. The lateral spinothalamic tract is taking the sensation of pain and temperature, and this is the correct option. And ventral and dorsal spinocerebellar tract are taking the sensation of the proprioception to the cerebellum. So correct option is the C. Superior cerebellar peduncle contains one of the following tracts. So we all know that the ventral spinocerebellar tract is passing through the superior cerebellar, remaining all are entering into the cerebellum through inferior cerebellar peduncle. So correct option is the B. Next MCQ is that the cross cerebri of the midbrain contains all of the following tracts except the frontopontine, the medial lemniscus, corticospinal, corticobulbar and temporopontine. So first look at this cross section. of the midbrain. So this is the area of the crus cerebri, and here you can see the temporopontine fibers are present, the corticospinal and corticobulbar fibers, and the frontopontine fibers are present. The lemnisci are present over here. These are not carried through the crus cerebri, so medial lemniscus is the option for this question, that it is not passing through the crus cerebri. Next question is, the signs of the Horner syndromes include all of the following except, that is ptosis, mydriasis, anhidrosis, anophthalmos, and dry skin of the ipsilateral side of the face. So please dear student, remember this Horner syndrome is because of the defect in the sympathetic nervous system. The sympathetic nerve supply to the eye and their level is in the cervical level. So correct option in this case is mydriasis, because sympathetic supply lesion in the sympathetic nervous system leads to ptosis and the meiosis, not the mydriasis. So this is the correct option. Hemisection in the cervical spinal cord may cause one of the following: the contralateral loss of the proprioception from the lower limb. No, this is the ipsilateral loss of the proprioception from the lower limb, because the tract which are carrying the proprioception runs in the spinal cord ipsilaterally, that is the dorsal column. Then the contralateral flaccid weakness in upper and lower limb. So we all know that the pyramidal system below in the spinal cord is ipsilateral. Again, this is the wrong option. The contralateral spinothalamic tract sensory loss in the trunk, and yes, it is the true option, because below the lesion in the hemisection there is a contralateral loss of the sensation, that is below the section, that is this, if the cervical spinal cord is affected, so in the trunk and lower limb there will be the sensory loss in the spinothalamic tract. So again, ipsilateral spinothalamic tract in upper limb is the wrong option. Signs of the upper motor neuron lesion includes all of the following, that is the spasticity, the hypertonia, hyperreflexia, the Babinski and fasciculation. So you must remember that the fasciculation is the sign of the lower motor neuron lesion and not the upper motor. So this is the correct option. Similarly, the signs of the lower motor neuron lesion include all of the following except, that is the atrophy of the muscle, the fasciculation, flaccidity, clonus, and hypotonia. So must remember, clonus is the sign of the upper motor neuron lesion and not the lower motor neuron, and this is the correct option. Next MCQ is that following nuclei project their axon to the cerebellum except the red nucleus, the accessory cuneate nucleus, the arcuate nucleus, Clark nucleus, and inferior olivary nucleus. So you must remember this arcuate nucleus is present in the thalamus and it is related to the secretion of the prolactin and also related with the development and the progression of the puberty. So this nucleus has no contact with the cerebellum, and this is the correct option. Next, as MCQ is upper motor neuron lesion can occur in any one of the following except. So this is the location. Upper motor neuron means that is the pyramidal system is affected, or any other upper motor neuron they are affected. So this is the internal capsule, the pyramid of the medulla, yes, it will be affected. The crus cerebri, yes, they are passing through the crus cerebri. Then the ventral motor nerve and the corticospinal tract. So ventral, in the case of the ventral motor neurons, ventral motor nerve, root of the spinal nerve, we know that the pyramidal system and the upper motor neuron they rely on the anterior horn of the spinal cord, and then lower motor neurons start. So in case of the ventral nerve root, there are the lower motor neurons which are affected and not the upper motor neuron, and this is the correct option. Lesion in the medial lemniscus causes contralateral loss of the pain and temperature sensation. The contralateral loss of the pain and contralateral loss of the sense of the vibration and the proprioception ipsilateral loss of the discriminative touch, ipsilateral loss of the pain and temperature, ipsilateral loss of the sense of movement. So we all know that the dorsal column medial lemniscal system is carrying the sensations, the fine touch, the vibration and the proprioception, and this dorsal column is sent ipsilaterally and they decussate in the medulla and then ascends as the medial lemniscus. So there will be contralateral loss of the sense of vibration and proprioception in case of lesion in the medial lemniscus, and this will be the correct option. The B will be the correct option. So now the MCQ is that the constriction of the right pupil when the light is directed at the left eye needs all of the following except. So constriction of right pupil is basically the consensual light reflex. And look at the pathway. So light is when the light enters into the eye, this is the left eye, and these sensations are carried through the optic nerve, and then in optic chiasma they are going through both the left and the right optic tract and optic radiation to the pretectal nucleus. So then to the pretectal nucleus, these sensations then enter to both sides of the Edinger-Westphal nucleus, and through Edinger-Westphal nucleus these sensations are carried through the oculomotor nerve. So in case of the right pupil, we have no use, the consensual light reflex are not carried through the right optic nerve. So this is the correct option. All other are required for the consensual light reflex. Nucleus ambiguous gives fibers to all of the following nerve root except. So the glossopharyngeal nerve, yes. Vagus nerve, yes. Spinal accessory, cranial accessory and recurrent. So please remember the spinal accessory nerve nucleus is present at the level of the C1 to C5, and this is not the nucleus ambiguous. The all other four nerves have their nuclei present in nucleus ambiguous. So C option is the correct option. The nucleus solitarius receives all of the following except the taste sensation from anterior two-thirds of the tongue via chorda tympana, yes. Taste sensation from posterior third of the tongue via glossopharyngeal nerve, yes. Taste sensation from epiglottis via vagus nerve, yes. General sensation from anterior two-thirds of the tongue via lingual nerve. So these general sensations are carried through the trigeminal nerve and they do not enter the nucleus solitarius. General sensation from viscera supplied by vagus nerve also enters to the nucleus of the tractus solitarius. So correct option is the D. Next MCQ is regarding thalamic nuclei. All are true except the thalamic nuclei. The anterior nucleus is part of the limbic system, yes. The medial nucleus is connected with prefrontal cortex, yes. It is related to the personality center. The ventral nucleus is connected with the motor and the premotor, yes. Ventroposterolateral nucleus, we also call the VPL, receive medial nucleus, yes. Ventroposteral medial nucleus receives spinal nucleus. So this is not the true, and option E is the correct option in this MCQ. Next MCQ is that regarding the medial geniculate body, all are true except it receives auditory information from both the ear but mainly from opposite side, yes. It receives auditory information from superior colliculus. So please remember, this is not the superior colliculus, this is the inferior colliculus, and this option is incorrect. Other options are correct, that is it projects to auditory area in some superior temporal gyrus. It projects through sublenticular part of internal capsule, yes, and a lesion causes bilateral diminution of the hearing. So B option is correct for this MCQ. Structure found within the cerebellum include all except vestigial, the dentate, the emboliformis, the caudate, and the globus pallidus. So we all know that the caudate nucleus is part of the is not the part of the cerebellum, and this is the correct option for this MCQ. Next MCQ is that which of the following is not true regarding internal capsule? That it is made up of the gray matter, the anterior limb separates the caudate nucleus from lentiform, fibers connecting frontal lobe to red nucleus are found in posterior limb, and corticothalamic fibers are found in the anterior limb. So first have a look at this diagram. This is the anterior limb of the internal capsule, this is genu, and this is the posterior limb. Here the here is the caudate nucleus which is present, and here you can see this is the globus pallidus and putamen, collectively called the lentiform nucleus. So the option that it is made up of the gray matter is basically incorrect. All other options are true for this, and A option is the answer to this question. And this is your last slide for today's lecture. Thank you all dear students for your attention for the today's class, and Allah Hafiz till the next class.